This is your A22 fitting guide. In the box, you'll get a bag, an A22 bag. You'll receive an ACL and OA fitting instruction guide. You'll receive some flexion stops for the Donjoy force point hinge. You'll receive air condyle pads, thicker air condyle pads to be placed around the knee if it is needed, an A22 undersleeve, and of course your A22 brace. This is your A22 brace, and I'll go through some of the other items here in a moment. But to get to know your A22 brace, you'll take it out of the bag. You'll notice that there are 5 straps, but I have also installed an anti-migration band. This is removable. The 4 strap here that I'm holding is intertwined with the 0 strap here, and then also the 5 strap, which is on the back here, is intertwined with it on the back. The 2 D-rings here are on the back and a single D-ring here. The rigid side of the Velcro is opposite of the soft side, and where the 4 and 5 strap integrate into the frame. So the A22 brace has essentially 5 straps, but we've added a 6th strap. We call that the 0 strap. So getting to know your brace, when you fit it, you'll do the 0 strap first, right here. You'll do the 1 strap here, and you'll loop it through this D-ring. Then you'll come up here to number 2. You'll loop it through that D-ring. Number 3, through that D-ring. Number 4, through this D-ring right here. And then number 5 is on the back, and you can tighten that down. When you're taking it off, doesn't matter what order you take it off in. I typically will start with the 4 and the 0, and then the 1, and then do the 2 and the 3, and I will always leave the number 5 strap attached. I can loosen and tighten it upon fitting, but I'll always keep it attached, especially if there's a 0 strap intertwined with it, because if I take it off, it could unloop itself, and this could pull through these D-rings. So I'll loop that back through, and then that can sometimes be confusing for some patients. So as I mentioned, the A22 is made out of titanium. It's very malleable, okay, but it's also very, I'd say, durable. So malleable, but very durable. It's going to take a lot to break this brace. There's a year warranty on the brace. Also, there's an ACL guarantee. So if you've ruptured your ACL within the first year of wearing your brace, if you re-rupture it, there is an ACL guarantee program that you can check out online. We like to put our money where our mouth is at Donjoy, and they can help you out with that ACL guarantee. So that's the brace. There's a couple different components to the Donjoy A22 brace that allow you to get increased protection. Number 1 is the hinge creates active proprioception or active compression around the medial and lateral joint lines. So when I put it on, I'll open it up like this, okay, and you'll see the compression around the medial and lateral joint line. What that does is it increases proprioception, or knowing where your body's at in space, and where proprioception, the increase in proprioception will decrease the risk of re-injuring yourself. A lack of proprioception is directly intertwined with more knee injuries. So there's the active compression. Also, the hinge, the force point hinge, as you go into full extension, you'll feel a deceleration. There's leaf springs that run the length of the force point hinge before going into a hard end stop. So that deceleration will keep you out of the at-risk zone, so extension and hyperextension. When your knee's flexed, you're at a lower risk of rupturing your ACL. The other component is the posterior calf. So we leverage the top of the tibia here with the 0 and the 4 strap, and when we tighten it down, it puts a posterior load on the proximal tibia, and that will prevent anterior tibial translation, or the shin moving forward, which is one of the main mechanisms of an ACL rupture. So those are the 3 components of the Donjoy ACL brace and how it protects you. Let's go ahead and start the fitting. So you're going to get your A22 sleeve. You're going to put it on like this. Okay, get it up high. The teardrop should be right under the kneecap. Now you're going to take your A22 brace. You're going to step through. and I'm going to grab the hinges because with a really good fit, it's going to be fairly tight around the knee. I'm going to set the brace high and back. That's going to be too low. That's going to be too high. I want these gel condyle pads that are concave. I want those wrapped around my medial and lateral joint lines, and then if I was to draw an invisible line across the middle of my patella, typically it's going to be about midline of the hinge, but everyone's anatomy is different. But for me, that's how I would set the brace. First strap you're going to do is the 0. So I'm going to get that nice and tight, and that's your anti-migration band. That's going to set the brace in place. Then you're going to come here to number 1. You're going to loop that through, and I always give a counter force with the opposite hand as I tighten that down. The most important straps, in my opinion, on the Donjoy brace are the 0, 4, and the 1, because that's going to press your tibia back to prevent anterior tibial translation. Now I'm going to come up here to number 2 and loop it through this D-ring. And number 3, cross here to that D-ring. And now we're going to do number 4, and I'll show you what I meant by the dynamic posterior load on that proximal tibia. So the Donjoy has Donjoy is the only company that has a posterior calf cuff. So as I tighten down this 4 strap, you're going to see my shin bone move backward just slightly to put active compression. See that? So it's going to bring that cuff forward, and then I'm going to place the 4 strap over the top. So I'm getting active compression along that front of the shin bone. And then we have the number 5 strap, and I'm just going to make sure that that's tightened down. So that's how you fit it, just like that, and then you're ready to engage in your activities. As I mentioned before, you also received a air condyle pad. If you want more active compression around the joint line, you can install these. These are Velcroed on. So after you take off each strap, I reattach it to the other strap just to keep it from wearing out the Velcro. But all you do is you take off that pad, and you're going to place the air condyle pad there, and then you will place this stocking over the top of the air condyle pad to install it. The Flexion Stops, the only time you're probably going to use these is if, and they are installed in the posterior side of the hinge. If you do injure yourself, again, while wearing the brace or not wearing the brace, and you want this as somewhat of a neomobilizer rather than getting one of those really long neomobilizers, you can stick the largest flexion stop into the back here, and there's just 2 notches there on that, and then insert the screw on the internal side of the hinge, and you will have essentially a neomobilizer. And that is your A22 custom titanium ACL brace.